And now, Wellness Wednesday, brought to you by Gladstone Psychiatry and Wellness. Care that meets you where you are.
In today's Wellness Wednesday, we're talking about weight management.
Dr. Debbie Brooks, Director of Gladstone Psychiatric and Wellness Center's Weight Management Program, joins us today to talk about it. And Dr. Debbie, thank you so much for coming in.
Thank you so much for having me. It's lovely to be here.
Oh, absolutely. Well, thank you. And this is a topic that so much buzz right now, GLP-1s. You can't turn on a TV without seeing the commercials. Tell us, get us started with this. Where do we start?
Sure. So GLP-1s are a really cool, new-ish medicine. They work by delaying gastric emptying. So food is sitting in your stomach longer. Okay. It makes you feel full faster and stay full for a longer period of time. It also works in your brain by kind of reducing the hunger signals. Okay. And that's typically where in the past a lot of diets have failed, because when you lose weight, when you have that calorie deficit, your biology is going to fight back. Okay. So you're going to get a lot of hunger hormones, and the hunger hormones are very strong. Yeah. And that's going to cause that increased craving. It's going to cause that weight regain. So these new medicines work differently.
Okay.
Okay. And what makes somebody a good candidate to take these GLP-1 drugs?
So they're generally appropriate and safe for adults and adolescents with obesity or an obesity-related medical condition. Okay. So something like sleep apnea or diabetes. That being said, they are not for everybody. So a careful medical screening is really important still.
Okay. And use. What is the best way? How do you use them? We hear all kinds of microdosing and once a week, once every other week. How do you use them?
So it depends actually on the specific medicine. There are once a week injections, there are once a day injections, and then there are now pills that are daily. Okay. So it really depends on kind of your individual needs, which is why, again, it's really important to work with a group that gets you.
Okay.
Yes. And you know, I've been seeing so many, because these are so popular now, people are getting them, you know, not through doctors. I mean, I'm sure like it's important to check with somebody first to make sure you're a good candidate, to make sure you're on the right dosage and all that, right?
Absolutely. And the concern is that if you're taking these medications without a careful screening, without a careful follow-up, who's monitoring things like your side effects, your mental health, pre-existing medical conditions, and then you want someone there when you're stopping, starting, or changing the dose.
Okay. So for more information, we have your website on the screen, GladstonePsych.com.
Absolutely.
All right.
Thank you, Dr. Brooks.
Thank you so much. Great information. I'm sure it'll stay in the news. We'll check back with you.
Yes.
All right. Thank you.
Wellness Wednesday on WJZ at 9 is brought to you by Gladstone Psychiatry and Wellness. Care that meets you where you are.